Mr. Speaker, the Secretary of State has set out how important data is to his strategy. Can he therefore explain why his government has a contract with Deloitte to cover the testing of COVID-19, which does not require Deloitte to report positive cases of COVID-19 to Public Health England or to local authorities?
Because the contract is with the department and the reporting comes through the department.
Robert Gilbert.
Does the Secretary of State share my admiration of care workers on the Yorkshire coast, including those in a care home in my constituency where an outbreak amongst admin staff in the office was contained there and not spread to forward-facing staff or residents? But would he also undertake to support local authorities like North Yorkshire County Council, who in the last fortnight have had to close 2 care homes in Scarborough run by the same company, where evidence from the CQC showed that that level of care was unacceptable and potentially dangerous?
Yes, my right honourable friend raises an incredibly important point. I pay tribute to those care homes, both in Scarborough and across the country, who've done the right thing and are tackling outbreaks when they find them, including some who go to extraordinary lengths to protect their residents, not least because we know that care home residents are amongst some of the most vulnerable to coronavirus. But at the same time, we must ensure that the level of care remains high, and the CQC does have an incredibly important role in this.
Patrick Grady.
Thank you, Mr. Speaker. Professor Michael Baker, who formulated New Zealand's world-leading elimination strategy, said that the UK has all the tools it needs to pursue containment and elimination if it chooses to. The alternative is going in and out of lockdown for months, if not years. Does he agree with that, and will he therefore confirm whether the UK government's strategy for COVID-19 is going to be centred on elimination rather than suppression?
Thank you very much. Well, we are absolutely bringing the case rate right down, and the fact that across the UK as a whole there were only 352 positive cases in the last 24-hour period, which is the lowest since before lockdown, demonstrates that that action is happening, and that's why it's because of this action, Mr. Speaker, that we've been able to allow people to have some more of the freedoms to enjoy things that they enjoy. And I'm glad to say that that strategy has been followed by all 4 governments within the UK. Maybe differences in detail and differences within a few days of a few bits of the timing, but essentially this has been a UK-wide strategy followed both by the Labour Welsh Government and by the SNP Government in Scotland.
Thank you, Mr. Speaker. Like so many across our country, I was very delighted to visit the pub for the first time over the weekend and had my first pint in a socially distanced fashion at the Durham Ox in Camden. I was really impressed with Susan and Phil in there for the work that they'd done to enforce social distancing and some of the ingenious measures they put in place, including diligently collecting the contact information of people who entered. So on that note, can my right honourable friend outline how COVID-secure guidance from BAYS is helping to support the vital NHS test, track and trace efforts?
Well, this is true, Mr. Speaker. Because of the actions that we've put in place, it means that we can open hospitality like pubs, and doing that safely means that we've been able to open more hospitality than we would otherwise have. I too went for a haircut and a pint on Saturday morning, and the haircut was on Saturday morning, the pint was very early in the afternoon. And I'm glad to say that my name was taken and my phone number was taken when I turned up at the pub. And I haven't been back to Suffolk, though, Mr. Speaker, since February. It's one of the things I've missed most about this whole crisis. And I'm going on Friday, and there I will go to the pub, and no doubt they'll take my number too.